Welcome in to Off Air with Amy. I'm Amy Wood. So glad you're here because there is a lot going on in the world right now, especially if you're focused on the Middle East somewhat, with a lot of military veterans and service members who call the Carolinas home. And so we want to make sure we're staying up to date. First of all, you can always go to WSPA.com to get the very latest developments. You can see our website is full of information. We're constantly updating you on what is happening, what the latest news is. But we also want you to understand that the military is important to 7 News, and we have always reached out. If you'll remember, during the war with Iraq, I was very involved in covering that, and I was helping you guys get a sense of what's happening with our military families throughout that conflict. And so in this new conflict, we have a new generation of warrior that's out there and new families who have never been through this before. So I reached out to the Blue Star organization. It's the Blue Star Families, and they focus in on helping the whole family. I mean, we're talking when one service member's out there, parents, sisters, brothers, aunts, uncles, grandparents, children who are all impacted by them being gone. Hey, everybody, we have Elizabeth Donatelli with us. She is the Senior Vice President of Marketing and Brand Matters at the Blue Star Families Organization, which is so critical to military families at a time like this. So, Elizabeth, let's talk about it. Back in the day, during the Iraq War, you were a reporter kind of like me, and I was doing a lot of engagement with military families, but this is going to involve this new conflict, a whole new generation of military families who may not even know you exist.
Yeah, it is really different, and it feels like it was so recently, but it has been long enough that we do have a new generation of
Yeah.
family members who are part of this, and obviously our service members as well. So, one of the interesting things that we've launched here at Blue Star Families is because of this conflict, there's a whole generation of folks who haven't been through this before, but there's a whole generation of folks who have been through deployments
Right.
and training exercises and things where separations involved. So we are launching a program that is specifically one-on-one mentorships. It's digital, so you don't have to live in a certain location.
Oh, that's
You
great.
can access it online, right? And it pairs up someone who's been through this before with someone who hasn't. So it's a really neat thing that we are putting together right now. And if someone's interested in signing up for this, bluestarfam.org, there'll be a sign up there.
Okay, that's good to know. And that is going to be the key website. I'm going to actually put up a QR code so that people will be able to use their phone, and you can screenshot it and then push on your phone and go right to it. It's real easy.
Fantastic.
But let's talk about what South Carolina's situation looks like. Are you getting any sense right now for how many military families are involved at this point?
Yeah, look, anytime the military is involved in some sort of action, every family is affected in some way,
Sure,
right?
that's true.
So South Carolina specifically, it's not unique just to South Carolina, but the tensions are high, wondering if this is going to affect your parents or your sisters or your brothers or your nieces or your nephews.
Sure.
I mean, pretty much everybody knows someone serving in the military. So the effect and the worry and the mental health and the strain goes really, really far. The stats, an interesting stat here, despite nearly 90% of Americans having a favorable view of the military and military families, interestingly enough, only 38% have actually taken action to support a military family. So just let that sink in right there.
Yeah.
So there's a lot of people who want to go out and help, right? But they don't know how specifically. So there's a couple things they can do just high level, right? You can volunteer. You can give, you can check in. And when I say check in, I mean offer tangible support, babysitting, bringing a meal to someone, just asking a neighbor how they're doing. Now, to be clear, not details of what they think of the operations or the conflict, but just
Right, the
how they are.
politics. Leave the politics out.
Exactly.
Yeah.
Exactly. And how they can help. So those are some things right there. But you did bring up something about South Carolina specifically. I do want to point out South Carolina is what we call a do your part state. Now, a do your part state initiative is a national bipartisan initiative led by Blue Star Families and the National Governors Association to help strengthen and support military families. The way we do this is by taking a holistic family approach that extends beyond the service member or the veteran.
Okay.
So, what this really means is these states who are signing on have decided, yes, we do want to support, and we're taking actionable, tangible action to do this to support these families. And South Carolina has a host of things that are happening, but I did want to flag something really neat to you. South Carolina has the Military Family Relief Fund. And what this
Yes, we
does is
do.
it offers emergency financial assistance to service members and their families during times of need. And, this is a time that really the support is needed. So that funding mechanism is incredible. They offer everyday South Carolinians the opportunity to pitch in a few dollars when they file for their taxes in order to help pay for it. So that is
That's good to
allowing
know that
people
you
to
that's
do
what
your
that
part.
is when you see it.
Yes.
Because a lot of times you see stuff and you're like, what is that? I don't even know what that is. So we're letting you know that you might want to put a dollar or two on there for them this time of the year. Let's talk a little bit about, though, the stress on families,
Sure.
both those deployed, especially those deployed right now, and especially if they are going through it the first time. Like, what are the essential things that they need to do and that we all need to do if we know have a family member that's in this boat, to really lift them up right now and help calm their fears? I mean, we're starting to hear about casualties, and that like elevates everything for people.
Sure. I think this all has to go to the fact that supporting military readiness starts at home. So, supporting your family members and the family members of the military gives some stability. And that stability then yields itself to the service members being able to focus on their mission. So, basically, it affects national security just by helping these members. So again, when we go back to that mantra of do your part, when families are supported, service members can focus on the mission. So
So
that's kind of
true.
the first thing that I wanted to put there. But you talked about the moment and the heightened anxiety. We
Hmm.
talk about military families, and what that really means. Just thinking how it could be affecting folks. There's the spouse at home managing everything alone.
Yeah.
There's the mom who dropped off her 19-year-old at basic training. She's maybe holding her breath ever since. It's a sister who's refreshing the news at 2 a.m. And there's the young child just uncertain what to make of it. So this affects the entire family.
And that's what you're talking about. When you say that you guys assist the whole family, you are meeting needs that go beyond the service member, go beyond the spouse. I mean, it's the whole
Mhm.
shebang.
It's the
Yeah.
whole family, and that's kind of what makes our organization so unique is we do look at that holistic picture, and we're specifically focused on the family and on the family unit. And just a little bit about us as Blue Star Families, we are the nation's largest military and veteran family support organization. And what a Blue Star family is, in case your viewers aren't
Yeah.
aware, it's a family of a currently serving military member. So that includes active duty, National Guard, reserves, and those transitioning out of service. So it's there's a lot of folks who are in that bucket, and then we as an organization have touched many people, 450,000 members nationwide. And since our founding in 2009, we've delivered more than $336 million in benefits and impact, and that touches 1.5 million people per year. So it's a
Wow.
pretty large reach.
And drill it down to actual help that's given. So, for example, what when a military spouse calls you and is like, "My person is in the middle of this thing," what are they usually wanting the most? Like, what is like the number one or top request that you get from someone like that?
That is a good question. We actually had some data come in here. Let me pull it up first. Specifically to this, and not just big picture. We kind of put out a pulse poll, just trying to get some anecdotal feedback of how
Hmm.
our community was feeling, and specifically around this. What's weighing on families is deployment uncertainty, routine disruptions,
Yeah.
national instability concerns, heightened anxiety, and then just some folks feeling unprepared for these deployments, which again goes back to what we were talking about with doing that one-on-one mentorship that we're doing. We're also hosting a webinar, so stay tuned for that. And it's kind of the same descriptions of how do you get through this and some actionable insights that folks can take as well as those personal stories.
When you look back at what Blue Star families have been doing through various conflicts, I mean, I'm talking way back 23 years to Iraq, for example. How critical is your mission?
Oh, it's so critical because if families aren't supported, then service members can't do their job. They can't fulfill the
Yeah.
mission. So it is vital to the stability of the all volunteer force. We're hearing from folks and our members on the ground is everything from as simple as expanding or strengthening security at posts and bases.
Mm.
And the first day, one of our members was telling us trying to get that the teachers at the school were having difficulty getting onto the post because the security line was about an hour
Too
and a half
long.
long. So there weren't enough teachers and administrators there when the
Oh,
kids were
wow.
coming to school. And so the parents had to step in and help. So, sure, that's an inconvenience, but
Hmm.
it is a way that lives are being disruptive, just on the
Yeah.
one example right there.
Yeah, absolutely. It is a lot for families to handle. We are certainly thinking of our military families, and we are definitely thinking of our service members who are in the middle of this right now. They've been activating and rolling these resources, these the military might has been on the move over there for a while. And I think, families have been living with that uncertainty at a level, but when it gets to this point where something starts, and you start to see casualties, it becomes a whole nother thing.
Well, we just want to support our families here at home, our families
Yeah.
overseas, and then obviously the service members who are boots on the ground as well, or there.
So I want to give you this QR code so you could just hold up your camera and face it with your phone at the television screen. Look like you're taking a picture of this thing, and you'll see a URL pop up, a website, and you just click on it and it will take you to their website where you can sign up for all of the things we've just talked about, whether it's volunteering, the mentoring program, you name it. All the resources are there to help you get in touch and get the help that you and your family might need. Welcome back. Senior citizens who are lonely. That sounds so sad, but it's the truth. A lot of seniors, unfortunately, wind up in an isolated situation. It may be that a spouse or another loved one has passed away and they're on their own, or, just the isolation of not being in community every day with people because maybe you don't have the job to go to anymore, or the other things that change as life evolves down the road. So, what we're going to do here is talk to an expert. This company actually works in the senior world. Like, they have a lot of businesses that are surrounding senior citizens, but they also do a lot of cool research. And so I've pulled in their head of communications to talk about what's going on with our senior citizens. Why are they so lonely? And how does South Carolina rank compared to the others?
Marlena Del Hierro with us, and she is with this group called Care Scout. It's a company that gets involved in helping us all out as we get up in our years later in life. And you guys have done this research that's really interesting on loneliness when it comes to senior citizens in the U.S. And I'm really curious to hear what you've learned about South Carolina. I understand that we are better than many states, but we still have some work to do.
That is correct. Yeah, I mean, so Care Scout, it only made sense that we focused on this topic. We're a one-stop shop for families, where we're helping families navigate through long-term care insurance, home health
Hmm.
options, assisted living options. So as you age, it obviously makes sense to kind of look at everything from where you are located, the holistic view of things. So when we're looking at loneliness, this is a real issue, and it's an issue that impacts care and it impacts health. So we thought that it made sense to look at all the states and look at a variety of different data and research that would come up with this list of states that are on the list of very lonely, or loneliness is more impactful there, versus other states that it's not so much. So
So,
I was going to say South Carolina ranking 13 on the list.
okay, so let's talk about what makes a state more lonely than another, or people within a state more lonely than another. What are you learning about the loneliness? I mean, why are people lonely?
Yeah, so for this specific report, we researched 6 different factors. So we were looking
Okay.
at the self-reportedness of loneliness, the depression rate, the percentage of people living alone who are in their 60s, to the relationship status. Are they single? And then are they regularly talking to family and friends, like having that support network? And the last thing is having the resources available to you to grab onto mental health support. So we looked at those 6 factors to really dive in to look at, where these states ranked.
And what did you find out when it comes to South Carolina? Did you notice any areas that we're really a little weaker in that we need to address here to help our seniors be less lonely?
Yeah, well, we'll start with the positive one. So like the
Okay.
positive things about South Carolina is that there's a low share of older adults who are living alone. So
Okay.
that's a good thing. So they have a support network. Maybe they're with their partners. Maybe it's an intergenerational home with their families. They're also they rank pretty high on having regular discussions with family and friends. So they have a support issue. They're talking about how their day is. They're having just normal conversations, talking about anything from what they like to do to how they're feeling that day. But the one thing where South Carolina ranked poorly is having the ability to connect with that mental health service. So they actually didn't rank very strong here. So you're looking at 15 resources or professionals to 10,000 older adults. So 65 and older. So this was the one piece where there could be some need of improvement. And we can kind of talk about, where we can look at that, from technology and telehealth, and where that industry is growing as well. But we also have some tips for folks when they are feeling lonely or how to prevent this.
All right, great. Well, let's dig into what if you're feeling lonely? What do you do about it? Like, what can you as an individual start to do to make a change, make a difference, and start to feel more connected?
Yeah, that word connection is huge. Set up regular plans, right? Set up
Okay.
plans with your friends, set up plans with your family. This could be in person. This could be a regular phone call, a FaceTime, right? So just have something on the calendar. This really helps people look forward to something, right? It's like if you're going on vacation, they say that looking forward to something in a week versus when you're actually on it brings somebody more happiness. So that's one thing. Set up a plan. Have consistent and routines with your people that you love. Then the other thing is community-based activities, right? So whether it's something local in your neighborhood, maybe it's at the local library. There's a lot of services and events happening at these local libraries or community centers, or even looking at colleges that are offering book clubs, right? Like having a group of folks to talk about something that is maybe not about yourself, but something that is more interesting, like something that you're learning, and then also just knowing that there are resources to help you at home, to support you at home. So maybe you're a very active older adult, but maybe you're actually somebody that could help with grocery shopping or some medication management. There are services and people that can help you make sure that you're taking care of yourself in that way. And one of the last things, as I kind of lightly mentioned, is using technology. Technology is one of the biggest ways that we can stay connected to the people that we love, to the services. So I mentioned, wanting to talk to someone to have that mental health support. Telehealth is becoming large. COVID did that. That pushed us into that.
Sure.
But there are a lot of different ways to use technology, not just, watching television. And it's, again,
Right.
communicating and learning from Alexa, from these smart devices in your home, to then, again, really be engaged and stay connected with things that you like to do and people that you love.
Yeah, and it makes so much sense. And I think that love of learning or continuing to learn new things, watching, tutorials on YouTube about how to do whatever it is you've always dreamed of doing, or you wanted to be a gardener, now you can be one, just watching YouTube videos. I mean, there's so many things we have control of. But what about the rest of us? Like, okay, you're a younger person in a community that's deemed to be lonely. What can we all do? I would assume, like, you said connection is so important, that all of us taking time to actually be connected to seniors, not just in our family, but in our community, people, your neighbor, an old coworker who retired, all these folks would love to still, I think, be welcomed back in and connected with and go to lunch and get a coffee and all that stuff, right?
Absolutely. I think like, when you look at COVID, when people were working remote and now
Mm,
people are coming back together and you're almost now getting used to, hey, let's have a coffee. Hey
yeah,
friend, let's go get a coffee or with a coworker to just leave your desk and to instead of have a meeting virtually, you have a meeting walking in the park on the phone, right? Like
yeah,
those are some strategies that I think we can all do that it doesn't have to be so virtual video. You can still use the phone, right? You could still, and I
right.
think this is also important for older adults. Like they might not feel comfortable using FaceTime or video, and they feel comfortable, being outside talking on the phone or having their telephone in their home, right? So I
Right.
think also that's another thing is being flexible to compromising in the way that your loved one, if you're a caregiver for your parent and they might not feel comfortable, so how can you shift some of the ways that you're used to working to make them to give them that option to connect with you in a different way that also is a way for you to also connect differently with that person. So
Well,
yeah, getting out there and talking and building the set of friends that really do make an impact to your happiness.
absolutely. Well, when you look at the study and all that you've looked at and the information, what surprises you the most?
I think that it's I mean, the biggest surprise is when you really do think of loneliness,
Hmm.
how it's not just lonely and you don't have somebody to talk to. It
Right.
is going to impact your health. There is data showing around this impacts heart disease, that this impacts, yes, your mental health, but that will, trigger down to other things
Sure.
that are health related. So I think we sometimes forget about when we look at loneliness, it's holistic. It might seem very non-medical, but
Hmm.
when that takes place, it can become a medical issue. It really can. And so that everything really is connected, especially where you live, especially where your resources are and how that you should advocate to make sure and what those resources are that will play into the factor of your happiness and could play in the factor of your loneliness as well.
And really quickly, I know that you have another study that's out about the cost of care. And, a lot of seniors are looking ahead, to anticipate, like if you have hit 55, but you're not retired yet and you're starting to go, what's this going to cost me? You guys put out studies on this kind of thing. What's it looking like? Like how intimidating is the cost of care as we age?
Yeah, I mean, CareScott is very proud of this cost of care. We do this every year, and it looks a little different every single time.
Sure.
I think it goes back to what we're looking at is that there are caregiver shortages, and that does
Hmm.
impact cost of care,
Sure.
as well as where are you living, where are you based, geographically. Are there a variety of senior living communities that
Hmm.
if there are not, again, the availability decreases. And with that decrease of availability, that then again, you have the cost of care or the care that will be impacted too. So, I want to give you all the information, but I think you'll just have to join our webinar in the next few weeks. Care. But no, this is public information. You can look at CareScout or cost of care
Okay.
survey results to really learn more about where you are located
Perfect.
and those numbers.
Okay. Well, it's good to have a handle on it and be prepared for the future. And it's great to know you guys are providing these resources to help people kind of turn the loneliness factor around. And I'm glad South Carolina's, not down there at the bottom of the list. It's good to see that maybe we've got one particular area we need to work on, but that's doable, right? I mean, we can get there. We can get
We
there.
have to pay attention to these things, right? If we're not
Yeah.
paying attention to these things, then we let it get out of hand. And so, just knowing that, hey, we're doing it right in this area, or these are areas that we can do something different. I
Hmm.
think that's really what it's all about, right? Bringing this to light and making sure that we're all aware, so that we can improve the way that our older adults are aging, and as we age as well.
And the bottom line is we can all be a good neighbor to our senior citizens. We talk about it like in storms and stuff, check on your neighbors, but we really should be doing that all the time, right? Making sure that people are well and healthy and happy and, inviting them to do things, having coffee, bringing a cup of coffee over, whatever it is that can help give our senior citizens around us a little more engagement. And I will guarantee you, if you sit down and actually talk to a senior citizen, you'll be surprised the cool stories they can tell you and the life lessons they've learned. It really will be a gift to you as well. All right, we are on the way. Now we've got to check. It's taking two of us to carry it. Jason, are you excited? Surprise! We are happy to announce that you are the Remarkable Women finalists for this market. Yes! Congratulations! Also want to give a shout out to Sandra Proctor Smith. She is the winner in our Remarkable Women contest. We get so many entries, and we have to pick 5 people, the winner plus 4 finalists who we feature on the news. And they're all worthy of winning. I mean, they're so amazing. All right, thanks for watching Off Air with Amy. I'm Amy Wood. Of course, we have more news always available on WSPA.com and here on WSPA Plus as well. And the YouTube channel for WSPA 7 News is full of constant new videos. So make sure you're taking advantage of all that. And I'll see you soon on the good old-fashioned traditional news. I'm on every day at noon, 4, 5, and 6.